for your question. Excellent. No one wants a recording of the intro call anyway. All right, so briefly going through the objectives for today, first is to establish familiarity with requirements for compliance with the final rule. We recognize that there's a lot of information that's out there, and we hope that the information shared today distills the key things that you really need to know, the tools that you need to have in hand in order to do a refresh of your preparedness plans. We'll spend some time thinking about the all hazards assessment, talking about what all hazards means and how to facilitate that assessment. And lastly, the key priority here is to help provide the tools that allow you and your team to be able to build out your emergency preparedness plans. What will make it usable, who needs to be familiar with it, and what parts need to be refreshed given the changes and events that have happened over the last 2 years. So before we launch into the foundation of the CMS emergency preparedness role and background, we'd like to launch this poll and get a sense for everyone's level of experience and familiarity with emergency preparedness in their health center. Fun fact, more than 130 people have signed up for this event across different functional areas. We see you, risk managers, quality assurance, revenue managers. There's so many different areas represented here. There are also about more than a third of you that are members of the C-suite as well as director level. And so we recognize how important meeting this requirement is to health centers and your long-term outlook. So we just want to make sure that we're able to address the different levels of experience coming into this conversation. So let me end this poll and share the results. Awesome. So we have a wonderful mix of experience here. And this really helps. Thank you for answering the poll. This really helps us understand where you're coming from as we go through the rest of this conversation. And really, I think, what it shows us too is that there's so many of us wearing different hats and coming from different perspectives here, but we are all members of the same community. And really, each of you are building and strengthening not only your health centers, but your communities at large. And the health centers themselves are pillars of your communities. I'm not sure if I shared those results, so I'm gonna stop sharing real quick. All right, with that, I will pass it off to my colleague, Melanie, to go over the CMS emergency preparedness final rule.
Great, thank you so much, Angie, for that introduction. I'm just going to be going over a little bit of background and information on some of the details of the final rule. And then I'll be passing it off to my colleague, Sean, who will really be discussing some of the ways that you can approach the final rule and meet the requirements that are outlined for your facility type. So just wanted to start off by introducing the overarching purpose of the Centers for Medicare and Medicaid Services Emergency Preparedness Final Rule before diving into some additional background information. So in September 2019, CMS issued the Emergency Preparedness Final Rule, which establishes the requirements for Medicare and Medicaid participating providers and suppliers. Ultimately, providers must be in compliance with the regulations of the final rule to be able to participate in the Medicare and Medicaid program. Overall, the final rule is intended to establish consistent national emergency preparedness requirements, increase patient safety during emergencies, and ensure coordination across all levels of emergency preparedness systems. Next slide, please. So just a little bit more background. The final rule was introduced actually in September 2016 and published on the Federal Register by CMS. However, HHS ASPR, which is the federal office charged with leading the nation's medical and public health preparedness and response efforts. They worked really closely with CMS to develop the final rule. It became effective in November 2016, and all healthcare providers were expected to be compliant within 1 year, so by November 2017. In 2019, CMS released certain provisions that revised some of the emergency preparedness requirements for healthcare providers and suppliers, which is why I'll see 2019 as kind of the final rule here throughout our slide deck. Requirements of the final rule do apply to all 17 provider and supplier types, which you'll see listed in this table on this slide. And then as of last spring, CMS shared an updated interpretive guidelines document, and that link will be provided for you all at the end of our presentation, so you can see where to find that online. Each provider and supplier type listed here has its own set of emergency preparedness requirements that address the planning and training needs for various emergency situations. These components are incorporated into each provider and supplier type's set of conditions or requirements that are needed for certification under the program. And to address these requirements, the final rule includes specific requirements in their 4 core elements. And these include emergency plans, policies and procedures, communications plans, and testing and training requirements, which we'll go over in a bit. Next slide, please. So I'd like to focus on 2 areas or considerations where the CMS final rule has been recently updated. So the first is an update to the review process across the emergency preparedness program. So under the review and update, facilities are expected to develop an emergency preparedness program that meets all of the standards specified within each of their 4 core elements. The program must describe a facility's comprehensive approach to meeting the health, safety, and security needs of both their staff as well as their patient populations during an emergency. And the program must also describe how the facility will coordinate with other regional entities as well as their whole community. So really you can think of the emergency preparedness program as the overarching program that has each of those 4 core elements that make up the program. So in the update, it was stated that every 2 years, all providers and suppliers must review their program and are expected to make the appropriate changes. This is a change from what used to be an annual review process. The second update was to include emerging infectious diseases, also known as EIDs, in the definition of an all hazards approach. So in February 2019, in light of Ebola and Zika, CMS recognized that it was critical for all health facilities to include planning for infectious diseases within their emergency preparedness program. And then with the onset of the COVID-19 pandemic, CMS further expanded their interpretive guidance to further expand on some of the best practices, lessons learned, and other planning considerations for EIDs. Some of these changes that you'll see in the interpretive guidance are things like added guidance on considerations for personal protective equipment, as well as planning considerations for surge and staffing needs. So what does this really mean for health facilities? Really, it just underscores that emerging infectious diseases do require plans for coordination with local, state, and federal officials, just like any other disaster or public health emergency. In terms of requirements for the final rule, it also means that when facilities conduct their all hazards risk assessment, which we'll touch on in a few slides, that pandemics and EIDs must be regarded. You know, when we say all hazards, we don't really mean that your center is required to have a plan for fires and another plan for hurricanes and another plan for infectious diseases. It really just means that your emergency plan needs to be applicable across a wide range of disaster scenarios. Next slide, please. So when you look at the interpretive guidance, you'll see that there are a couple of specific considerations for federally qualified health centers and rural health centers that are noted. And I just wanted to quickly go over some of these things that you might find in the document that really pertain to your facilities. So the first is that for rural health centers and federally qualified health centers, It's that these facilities must place exit signs to guide patients and staff in the event of an evacuation from a facility. The second would be for the training requirements. And this is really for all outpatient providers, but that will include your health facilities. And what it states is that your facilities are required to only conduct one testing exercise on an annual basis. This exercise may either be one community-based full-scale exercise, or it can be an individual facility-based functional exercise. If your facility does choose to conduct that community-based full-scale exercise, then you're not required to do that every year. On the opposite year, you can do a whole of community exercise in which your facility can choose the testing exercise of your choice. So this can range from a mock disaster drill, a training exercise, or a workshop that includes a facilitator. Just another thing that's important to note under trainings is that if your facility does experience an actual emergency event that requires you to activate your emergency plan, then you will actually be exempt from engaging in your next required exercise following the onset of that real life event. Next slide, please.
Melanie, I think you're fading out every now and again. So if you could continue, just speak loudly. Thanks.
Sure. Okay, so I know I've kind of alluded to these 4 core elements, and really this is how the final rule can be broken down to. It includes the emergency plan, policies and procedures, a communications plan, and a training and exercise requirement. So I'll offer a little bit of detail on the requirements of each of these elements, but really, I just want to note that the best place for you to find information on the final rule in a really easily digestible way would actually be through the Ask for Tracy website. It'll include handouts that you can print out and really keep on hand that are really comprehensive, so you can refer to them at any point that you may need to. So I'll start with the emergency plan. The emergency plan is really anchored in the all hazards risk assessment in that your emergency plan must be based on a documented, facility-based, and community-based risk assessment that utilizes an all hazards approach. The plan should address your patient population, which includes the type of services that your health center has the ability to provide in an emergency situation. And it should also include your plan for your continuity of operations. So something like how your delegations of authority would be administered across your staff. The emergency plan should also include a process for cooperation and collaboration with relevant local, tribal, regional, state, and federal emergency preparedness officials. And finally, as mentioned earlier, this plan must be reviewed at least every 2 years. Moving on to policies and procedures. The focus here is that your facility will develop and implement policies and procedures based on your emergency plan, which includes the risk assessment as well as your communications plans. Policies and procedures, again, must be reviewed and updated at least every 2 years. These policies and procedures will address a range of issues, which could include safe evacuation from a health center. So this would include the appropriate placement of exit signs, like I mentioned previously. It may also include a means to shelter in place for patients, staff, and volunteers who have to remain in a facility during a disaster. It can include a system of medical documentation processes that protect patient information, and it should also describe the use of volunteers in an emergency should that be needed. For your communications plan, your health center must develop and maintain a communications plan that complies with federal, state, and local laws, and again, must be updated every 2 years. Your facility's communication plan will help to coordinate patient care within your facility, across providers, and also with your respective state and local public health departments or emergency management systems. You should plan for your emergency plan to include things like contact information for staff, providers, patients, and other health facilities in your region. You should also maintain contact information for federal, state, tribal, regional, and local emergency preparedness staff. You should describe the mechanism that you'll use to provide or release patient information should your patients need to be evacuated. and also a means of providing information about your health facility's needs and your ability to provide assistance. And that kind of thing would go to whomever the appropriate incident command center is in your jurisdiction. So then finally, for trainings and exercises, your health center must develop and maintain an emergency preparedness training and testing program that is based on all of these other components. So your emergency plan, which includes the risk assessment, your policies and procedures, excuse me, and your communications plan. This training and exercise and testing program must be updated at least every 2 years. However, you will still be required to actually do the training and testing itself annually. Your training and testing program will include things like initial training and emergency preparedness policies and procedures to all new and existing staff, providers, as well as volunteers. And in that training process, you'll have to maintain documentation for all emergency preparedness training and also demonstrate staff knowledge of emergency procedures. You'll also be required to conduct exercises that test your emergency plan at least annually. And your facility should maintain documentation of all drills, tabletop exercises, actual emergency events that happen, and so that you can revise your facility's emergency plan as needed. And then lastly, just as a final consideration, if your emergency preparedness policies and procedures are significantly updated, then your facility must conduct training on specifically those updated policies and procedures. Next slide, please. So then finally, the last of these core elements, which I intentionally kept separate, is because it really will only apply to your facility if you are part of a larger healthcare system. But under this element, if your facility is part of a larger healthcare system that elects to have a unified and integrated emergency preparedness program, then your facility has the option to participate in that coordinated program. If that's elected, the unified system itself must demonstrate that the unified and integrated emergency preparedness program is in compliance with those other 4 core components of the final rule. So that was kind of a background on all the things that are included in the final rule and that your facility will be expected to comply with. I'm actually going to pass it over to my colleague, Sean, who will kind of give you an idea of what this looks like in practice and how you can implement some of these in a really approachable way across your facility.
Apologies for that. Was trying to answer a couple of the questions that were coming in, but yeah, no, thank you for that handoff, Melanie. So yeah, as Melanie had briefly touched on, there are these 4 core elements of the CMS emergency preparedness final rule. That first element being developing an emergency plan based off risk assessment for your facility, right? And one of the thoughts I had when trying to build out this training and talking with the Archer team, developing this webinar, I was thinking of bite-sized information, right? And as we saw from that first poll, we do have a lot of, veteran emergency preparedness people on the line, but we do have some people that are actually completely new to the emergency preparedness game. So when thinking about this bite-sized information and whether this information is actually new to you or even just a refresher, I wanted to take these 4 core elements piece by piece, which is why I'll be focusing mainly on developing an emergency plan today. Next slide, please. So yeah, just wanted to start off with some common questions that, we see quite a bit, starting off with what even is an emergency response plan, right? So as defined, an emergency response plan provides the framework for the emergency preparedness program. And that emergency plan is developed based on facility and community-based risk assessments that assist the facility in anticipating and addressing facility, patient, staff, and community needs and support continuity of business operations, right? So now going right into that second question, how does an emergency response plan and business continuity plan tie together? So the business continuity plan is to incorporate all continuity operations and business continuity, right? which involves planning to ensure business operations will continue even during a disaster. The whole concept of the continuity is the facility's ability to continue operations or services related to patient care and to ensure patient safety and quality of care is continued throughout an emergency event. Now, looking at the emergency plan, that plan is to provide the framework, which includes conducting facility-based and community-based risk assessment that will assist the facility in addressing the needs of their patients' populations, along with identifying the continuity of business operations, which will then provide support to services that are necessary during an actual emergency event. Now, the third question, right? The biggest one, will this response plan even work when we need it? And of course, the short and sweet answer is yes. Yes, of course, the plan is meant to work. But that does bring up the important point of developing an emergency plan, which is that an emergency plan is intended to be read, right? Not just sit on a shelf somewhere. The only way an emergency response plan can be effective is if everyone from leadership and staff, and that staff includes clinical and non-clinical, is ensure that everyone is caught up and understands their roles within a response. Now, both questions 4 and 5, right? How do you incorporate an emergency response plan into practice? And then how do you develop meaningful plans that don't overwhelm staff? I feel like both these questions kind of relate back to that idea of developing an effective response plan, right? And the best way to implement a response plan is through practice and training. But again, it's essential that the plan, while still being extremely effective and precise, is also easy to follow along with, and all the staff is caught up to the speed on plans. So now the 5th question, right? Overwhelming staff is the last thing you would want from a response plan, because within a response plan, everyone will have their own roles and responsibilities, but then also they'll be dependent upon others. So one of the best ways to actually develop meaningful plans that don't overwhelm your staff is getting your staff's feedback while building out those plans, right? It kind of seems hand in hand. It seems pretty simple to think of, but that is such a key component to developing a meaningful response plan. While certain people might be comfortable in different roles, when it comes to that response situation, you want to make sure the people in charge are calm and collected, because that feeling will then trickle down to the rest of the staff. Next slide, please. Right, so, I keep bringing up this idea of like bite-sized information and meaningful response plans, and I wanted to really hone in on 3 key components of developing an emergency plan, and we'll delve into each component as we go through this webinar. But, the first component being conducting a risk assessment specific to your facility using that all hazards approach. The second being developing a continuity of operations plan for your facility. And then third, including a process for cooperation and collaboration with external partners that will aid in the response effort. And, as I go through these 3 key areas, again, these were just the 3 key areas that I identified, but feel free to comment in the chat or raise your hand for any other ideas or areas that you feel are key components to building out your emergency response plans, because, not only would I love to hear them, but I'm sure some folks on here who are new to the emergency preparedness space would definitely love to hear your comments. Next slide, please. It's fine, I'll keep going. Thank you, Angie. But yeah, so just kicking off the first of the 3 key components, every facility must conduct an all hazards risk assessment and then develop their emergency plan in consideration of that risk assessment. So yeah, we have another quick poll here, and I just wanted to start off with this to kind of get a sense of, whether or not you've already incorporated your learnings from COVID-19 into your emergency response plans, or if you haven't yet, you plan to. So we'll give it, around 30 seconds or so, and we'll see the results.
Also, I saw your question in the chat, Reese. Do you mind sharing where you are located? It's helpful to know whether those clinics are where they are geographically or how far apart they are. we'll keep an eye out for that response, and I will end the poll in just a few seconds.
Awesome. So yeah, seems like, it's pretty split down the middle there. 41% of you have said yes, you incorporate learnings. 53% said no, we plan to. I am surprised to see a couple of people said no, we don't intend to. I would love to hear the reasoning behind that, especially in the environment we are in the last 2 years. We've been experiencing that pandemic. So, you don't have to share your reasons, but if you would like to, feel free to comment that in the chat. But again, I just want to use this poll to emphasize the importance of, considering the impact of COVID-19 in your risk assessments and response plans. And we'll kind of go into that further in the next slide when we describe the all hazards approach. So yeah, I keep bringing up, and Melanie had brought it before, this idea of all hazards approach, and it's defined in many sources as an integrated approach to emergency preparedness planning that focuses on capacities and capabilities that are critical to preparedness for a full spectrum of emergencies or disasters, right? And I know Melanie had touched on it before, that idea of the full spectrum of emergencies or disasters. This includes notice events such as, natural disasters like hurricanes or large-scale security events where there's an opportunity to forecast needs ahead of time. But on the flip side, this includes no notice events, right? Like natural disasters like earthquakes or even active shooter situations where you'll really be relying on supplies and staff on hand. So when we think about all these possible hazard events that occur in the world today, it might seem a little bit overwhelming. And like we said at the top of the section, the last thing we want to do is create an overwhelming response plan and burn out staff. So that's why when we discuss this all hazards approach, we are not saying that you need an emergency response plan for each and every hazard that occur at your facility, right? Like Melanie said, we don't need one for fires, we don't need a separate one for hurricanes, and a separate one for active shooters, etc. Now, what you do need is an emergency response plan that is applicable to a broad spectrum of hazards, right? One way to think about this would be you have clear steps to follow if your facility's power goes out, right? And the power outage might have been caused by a fire, and then your city shuts down their electrical grid for an extended period of time, or maybe a hurricane knocks out your power, or even something as local as a car crash taking out your power lines that's connected to your facility. All that to say, in your emergency plan, right, in the event of a power outage, it's related to all those different hazards. And of course, as Angie had brought up at the top of the webinar, we do have health centers in this webinar located in various places across the nation. And you guys all do endure region-specific hazards, right? California health centers seeing wildfires more, Florida health centers seeing hurricanes. So when developing these emergency plans, you can allude to those specific hazards, but the point we're trying to drill on is making one comprehensive plan that dictates what the facility and its staff should do during a hazard situation. And from that perspective, we're thinking to not overwhelm your staff because it's easier to follow one plan that encompasses all hazards versus a million different other plans. So we keep bringing up, developing this risk assessment, and another term for that would be conducting this hazard vulnerability analysis, right? This HVA. This is a method or a tool that you would use to list out the hazards that could potentially impact your facility and then assess which of those you are most vulnerable to. Effectively, you're basically prioritizing the hazards to determine which of those you want in the back of your mind when you're developing your emergency response plans. Now, the resource here shown to you on the slide is actually the Kaiser Permanente HVA tool, and it's found on the Asper Tracy site. We have a link to it on our resource package slide at the end of the webinar. Also, you could just Google it, Kaiser Permanente HVA tool, and you would find it there. I'm sure some of you have heard of the tool or even used the tool already, but if you haven't, I really can't stress enough how amazing of a tool this is to conduct your risk assessment. Again, I won't dive into this tool too much because you can easily use it on your own. The instructions are right there when you open up the spreadsheet, but I will just briefly go into the idea that the spreadsheet will have a long list of hazards. Your emergency management team will then evaluate each one of those hazards and answer a number of questions about each hazard, right? Such as, what is the realistic probability this hazard could impact your facility? If the hazard were to occur, what would the potential loss to human life be? What would be the potential loss of property? What would be the potential loss of business? And then you'll weigh those 3 questions of potential loss against your preparedness thus far. So then what is my preparedness level at to date? How are we prepared to respond internally with supplies on hand? And lastly, how prepared am I to reach out into the community for external assistance? So at the end of all that, you answer all those questions, you'll have a prioritized list of hazards that could potentially affect your facility. Again, I didn't want to spend too much time on the actual tool itself, but like I said, the resource will be available to you via link at the end of this webinar, but also you can easily Google it or find it on the Ask for Tracy site. Excellent, thank you. But yeah, so now you have your risk assessment complete, and realistically, with the right people in the room from your emergency management team, that risk assessment using that HVA tool could be done in as easily as one afternoon. But so now you have your risk assessment complete, and now we want to move on with developing the rest of your emergency plan. So the next part being the continuity of operations. So when thinking about continuity, right, and having this continuity of operations plans, it can be broken down into 4 areas. The first being essential functions, right? Essential functions are those that must be maintained in order to fulfill the mission statement of your community health center. So basically, continuing to serve your communities by providing information, updates, direct care as you usually do. And when writing out the plan, you really want to think about those essential functions that should be, or the operations that cannot be interrupted, for more than 12 hours, or that must be resumed within 30 days, right? The key activities that your health center fulfills on a day-to-day basis. Again, if any of you have, great examples of these key tasks that you would want to list out, feel free to add them in the chat. I'm sure, as I've said multiple times now, people who aren't as familiar in this emergency preparedness space would love to see examples from people who have been in the emergency preparedness space for 2 years plus. Now, the second key component is essential personnel, right? Essential personnel are staff members that are designated by directors and the emergency response team to be critical to the continuation of key operations and essential functions. This relates back to those, important roles and responsibilities given to leadership and staff, so they know exactly what they're supposed to do in the event of a hazard. The third key component being critical resources. And, we do recognize how important maintaining critical resources is at the community health center level, right? Especially when resources, might not be as abundant as they are at major hospitals. So critical resources are really a key input needed so your facility can carry out those essential functions. And then last but not least, identification and location of alternate facilities. A little self-explanatory in the name itself, but determining if it's possible to set up an alternate or temporary location if your primary site is unavailable. So if a hazard event calls for your facility to evacuate or move locations, it's critical that you continue those operations and essential functions for your community. So again, I've said it multiple times, I want to keep up this theme of, not being overwhelming. So I want to apply this same tactic for you building out your own effective emergency response plans within your facility. So when thinking about the continuity of operations and working them into your emergency plan, I think we can simplify even a little bit further into what I like to call the 4 S's of emergency preparedness and response. And you can use these 4 S's to determine how robust your plan is. So that first S being staff, right? Related back to that critical personnel component. Staff is such a key component to your emergency response plan as it applies to all personnel, right? Clinical and non-clinical. So we're talking about your physicians, technicians, nurses, but also security, housekeeping, and even volunteers. And all these folk have roles and responsibilities when it comes to the mitigation, preparedness, response, and recovery, and it needs to be clearly mentioned in your emergency response plans. Especially in this day and age and environment where staffing shortages, they're seen all across healthcare, but especially at the community health center level. That's why it's so important to clearly determine roles and responsibilities of those staff members. And I do want to emphasize not just staff members, but also volunteers. And then it's important to also list off, the backup or secondary contacts for those roles. In a slide after this, we actually provide an example resource for how you can go about listing out those roles, responsibilities, point of contacts, and even backup contacts. And then also, going back to honing in on that use of volunteers, if a facility uses volunteers as a part of their emergency staffing strategy, you just got to remember it needs to be clearly outlined what type of volunteers would be accepted during an emergency and what roles those volunteers might play, right? Medical versus non-medical volunteers. So then moving on to the second S, supplies. This is related back to that critical resources component. So another component for health centers, because we do recognize and understand that health centers aren't always stocked up as major hospitals and other health systems, but the impact you guys have on your communities, being community anchors, is just as valuable as any other major hospital. So to ensure the continuity of operations, it is so important to make sure your critical supplies are accounted for. So this can be done by addressing the quantity and the quality and supplies that may be mobilized as needed. An example of this is, pharmaceuticals you have on hand, durable medical equipments, consumable medical equipment like PPE, and then other supplies like drinking water and food. An example of implementing this into your response plans would actually be having a checklist for all of those essential equipment and supplies on hand. And we actually do have another resource for you to take back to your facilities. It's a nice little one-pager pertaining to durable medical equipments. Because as you know, in today's environment, with so many people within our communities staying at home and isolating, the importance of durable medical equipment has skyrocketed, right? And so, because it allows those folk to, live independently at home. So we've developed a quick little tip sheet, and it's a checklist of durable medical equipments, the effects of disasters on the DME population, and then also where priority should be appointed. The third S is structure, right? And this is related back to those alternate facilities. So structure refers to the physical structures that the healthcare system uses to provide medical care, including both the existing facilities used in daily patient care, as well as other facilities that may be repurposed for use for care only in a disaster, and temporary facilities that may be constructed or deployed during an event. Right, so you can break this out into 4 different sections. Measures related to that structure that may impact quality include the appropriateness of the facility, right, to support necessary clinical care, the accessibility of the facilities to all patients who require care, the resiliency of the structure in the face of known or suspected threats, and then lastly, the capacity for timely mobilization of core facility areas to address clinical needs. And then finally, the last S, systems, right? So systems examines the plans, policies, and protocols, as well as the laws, technologies, and structures that affect readiness. Measures within this domain examine incident leadership, as well as communication and information sharing networks. And I really want to stress communication and information sharing networks, not just within your facility, but also with external partners. Measures apply to healthcare systems relationships, both formal and informal, with one another, as well as their local, state, and federal government partners, as well as other non-governmental organizations, both professional and volunteer. So I know that was a lot of information, but I really wanted to break it down into those 4 S's. Remember, staff, supplies, structure, systems, and then also, like I had referenced on that previous slide, This is just a real quick example, an easy setup of a grid of the roles and responsibilities of your staff members or volunteers, clearly labeling primary and secondary contacts for leadership who are responsible for activating emergency operations plans or even listing out volunteers. Again, we stress the point of having secondary contacts, right? I can't stress it enough. In today's day and age, when staffing shortages are running high and people are, missing work due to COVID, an event can occur at any time. So if someone's out, make sure you have a secondary contact that knows what to do. Again, this is just a quick little way you can list out those contacts, but feel free to let us know in the chat if there are any other tips or tricks or ways you're actually listing out, your contacts or divvying them up. And then again, as mentioned on the previous slide, this is the durable medical equipment tip sheet and checklist, and this will be provided to you at the end of the webinar. And this is a one-pager that you can take back to your facility. So looking at emergency preparedness and response now within the facility, right? We see the 4 S's listed out there relating to the continuity of operations for the health center response, right? And as we look at the continuity of operations that happens within the facility, that last S there, systems, really hones in on the final part of the emergency response plan that we'll go over today, right? That cooperation and collaboration. And remember, we're emphasizing the importance of information sharing and communication, not just within the health sector or the health center, but now also with external partners, right? The state, the local, and even the federal level. And remember that there are these support avenues out there designed to help to respond to hazardous events that you should be connecting with and pointing towards within your own emergency response plans. So as referenced the last section, I know this has been a lot of oh, sorry.
Yeah, we just have one hand raised, so I just wanted to give them the opportunity.
Oh, yeah.
Sherry, I'll go ahead and unmute you. Feel free to ask your question. You might be double muted. Okay, no worries. I'll go ahead and turn it back over to Sean, but feel free to follow up in the chat or we can circle back at the end of the webinar as well.
Yeah, I know. I still have so many technical difficulties as well. So if you're having trouble unmuting, feel free to just shoot your question in the chat and we'll be sure to get to it. But yeah, moving on to this final section of developing an emergency response plan is the cooperation and collaboration section. So I know I provided a ton of information on that last section, so I won't be spending as much time on this section because I do want to let you know there are plenty of resources out there on the Ask for Tracy site. But we did want to touch on 3 response entities, those being healthcare coalitions, emergency support function 8, and local community lifelines. So the first one I wanted to touch on was healthcare coalitions. And as many of you are probably already aware, healthcare coalitions are groups of local healthcare and responder organizations that work together on challenges and find solutions that improve emergency preparedness and the health and safety of their communities, right? So they reflect the actual needs and features of their local areas. And they help healthcare facilities on a bunch of different things like planning, organizing, equipping, training, exercising, and even evaluating the healthcare system preparedness in their regions, right? So they're actually a great resource for expertise and preparedness, kind of a one-stop shop as it relates to preparedness in coordination with your local communities. And they're actually able to provide, a bunch of templates or example plans and policies, but also healthcare coalitions have been leaned on to help set up and coordinate community-based trainings and exercises. So these next few slides, they're actually dedicated to listing out all of the healthcare coalitions in your respective states. It's about 4 slides. And again, don't worry, we will be sharing this slide deck and resources with all of you in attendance after the webinar, so you can kind of dive into these later. But again, I do suggest, being in contact with your local healthcare coalition. So yeah, looking at emergency preparedness and response resources, right? We have, we just looked at your, state healthcare coalitions. Now we have ESF 8, Emergency Support Function 8, and local community lifelines. And I won't go too deep into ESF 8, which is public health and medical, as it's a federal supports function, and we really want to focus on the external support that will help during the, immediate response during an event. But there are plenty of resources on ESF 8 at the FEMA National Response Framework, which is linked there. So looking at these community lifelines, these are your key external partners that will help in the immediate response and recovery of a disaster. And knowing which external partners to call for during specific events and hazards is just as important as training your internal staff on their roles and responsibilities, right? Similar to your internal staff, an example for how that information can be laid out is by listing out, the agencies or organizations, their purpose for contacting them. I cannot stress that enough. Their name, their contact information, and then the key is familiarizing your staff with those partners, right? Because the last thing you want is your staff seeing that list of external partners for the first time during an event and being too overwhelmed to know who to contact or what the purpose for contacting them is. So clearly labeling that purpose and then also familiarizing your staff with those external partners are 2 points I think you should hone in on completely. And then again, this is actually a resource that is forthcoming. We are planning to build this out for you guys as much as possible with specific contact information for each state. But then when we turn it over to you guys, that's when you can kind of fill in those specific local community lifeline contacts, right? We do plan to include this resource in our monthly newsletter that will go out to all the health centers who are in attendance here today. Again, following this webinar, we'll be sure to add everyone to that distribution list for that newsletter so you can receive this. And then again, this is just that last slide, that resource package I've mentioned numerous times throughout the webinar, but it does have the link to the Kaiser Permanente HVA tool. Like I said, we will be making sure all you facilities are getting that durable medical equipment tip sheet and checklist. We do have, the list of healthcare coalitions for your states and, the contact information for that. And then also we do have the updated health center requirements for the CMS emergency preparedness final rule. That is an amazing, great guidance list from Asper Tracy. If you go through that, it actually lists out, the 4 key components and what you need to build out your emergency, operations plan. Additionally, I do just want to add, Healthcare Ready does have a CMS Emergency Preparedness Knowledge Center on our website. You can visit that, but it'll also be referenced in our newsletter that is coming out, I think sometime in February, but Angie, correct me if I'm wrong there. But yeah, I know that was kind of like me talking for like 30 minutes, but I do appreciate everyone attending today. I want to open the floor to everyone for questions, but also open the floor back up to Angie and Melanie to see if they have anything else to add.
Yeah, I think Sherry's actually had her hand raised for a while, so wanted to see if we're able to open up the floor for her as well. Let's see, Sherry, if you're able to unmute yourself.
I'm sorry, I don't know why that's up like that, but I couldn't get it to come down.
No worries. Oh, okay. Did you have a question?
No, I don't.
All right. Well, we appreciate you making a guest appearance on this call. Thank you so much. Thanks, Sean and Melanie, for all the great information too, and really to our audience for all the really excellent questions and information that you're sharing with each other. Again, there are CHCs from across several different states here, so really appreciate learning from each other here.
Angie, I think we have one more hand raised, so I'm just going to give Sherry Stone the opportunity to ask that.
I will keep talking until someone interrupts me. Feel free to drop any additional questions in the chat. Let's see. One of the questions that we received earlier was, we have so many sites or so many health centers. How do we coordinate drills and trainings? There's no easy answer to that, but there are many different ways to do that. And one of the things that we highly recommend is engaging with your local healthcare coalition. They will get you connected with health systems in your area, emergency services, nursing homes, if they're part of the healthcare coalition. So they really are a great one-stop local shop to get involved in a drill or an exercise. Ingrid, I'm gonna feel free to unmute yourself.
Hi, I'm Ingrid Pearson at Eau Claire Cooperative Health Center. This has been very informative. I think we need more of this in smaller groups in all of our different areas to be able to help us to coordinate a lot of people who are not medically oriented, nursing oriented, et cetera, to put this together so that everyone understands what their role is and how to operationalize it. I have put together what I have put together for here. It is keep it simple, but it needs more information than what I have in it currently, based on all the things you have brought up today. So I need some assistance in being able to do that. And I think that, we have the Midlands here, DHEC meetings and that, where we have emergency hospital, community health center representatives. And I think it would be good to perhaps draw them into helping us in this region to really actualize what our response is and help us to write meaningful things that really make a standard of practice, should we say, so that everyone has a standard that is appropriate, okay, and simple to understand.
Yeah, you bring up so many good points, Ingrid. I'm curious to learn, what region are you from?
I'm in Columbia, South Carolina, Midlands region. Okay. I'm also working on the same thing for our church in Aiken, South Carolina, so, which is a very different situation, but no less the same kind of things to make it simple so everyone knows what their role is. But this is something that I've been interested in and worked on now for several years. And I think that we now have enough information, not me personally, but as a group, to really make this even better than what we have currently in place. And so everything you brought up today is very important, and it's how to put it into something that is simple to actualize.
I think that's key, translation. And like you say, make it simple to actualize, understanding that we all have so much going on. Thank you for those comments and sharing those insights.
Welcome.
And one thing I kind of wanted to add onto that, I think Ingrid brought up a great point of, building a community, coming together to, go over these things. I think one of the main reasons why we want to build out this Archer program was to, build this community of community health centers across the nation, right? And we're bringing together folks that have a lot of experience, but people that have none experience at all, right? One thing Ingrid brought up, there is a lot of like intricacies and stuff that goes into developing an emergency plan, and it can seem overwhelming, but I think that's why, building this community, but then also getting together with other health centers, connecting with them is so important, right? Because when you're writing, like who's really writing their own emergency response plans from scratch, right? We kind of use plans from similar health centers and other health systems, and then we update them accordingly, right? It's never copy and paste, but it's those incremental changes and updates that will help to like improve and adapt the plan to your own facilities. So definitely hear you, Ingrid. We do have, this is, just the first of a webinar series that we plan to, help provide information on a bunch of different topics. But in regards to complying with the CMS final rule, we do have another webinar coming up, going over kind of the policies and procedures and even the communication plan section, as well as the training and exercise.
All right, and I see that we are at time here. Thank you again so much for your time and joining in this session today. I know we have a couple outstanding questions here, particularly around business continuity plan combined with the emergency response plan, questions around templates. We'll look for that information and share that out to you. Cheryl Moss also dropped her contact information there. If folks have a useful resource, that would be good to share. Thank you so much again. We hope you have a wonderful rest of your week. Take care, and we'll see you on the next session. Bye-bye.